Gentlemen, you've both been given copies of the new agenda for Kentucky campaign, the 5 initiatives that the Kentucky Chamber of Commerce is embarking on to hopefully change a number of methods and funding and a number of other factors in the state of Kentucky. And you've also been given an advanced copy of Building a Stronger Bucket, which everyone will receive this evening when the embargo is lifted. It is a stronger bucket because it enhances or plugs a few holes in the leaky bucket that you've heard so much about over the last few years. So if we can, and begin this way, Representative Stumbo, let me just ask you for your a quick overview of the 5 initiatives that the Chamber is looking at, and any comments that you have on the prior leaky bucket initiative, and some comments that you have been you've been privy to on building a stronger bucket. And again, Speaker Stumbo, if you would.
Well, thank you, and thank you all for having me back today. You know, I think that it's important that we sort of take these things into focus. And the fact of the matter is in Kentucky that we have not had a major tax increase since 1990. And we saw a study just recently, Bill, the last couple of weeks that the University of Kentucky did that shows that the education monies that we invested in the Kentucky Education Reform Act in 1990 truly are paying off. And they're starting to pay dividends. That our 8th grade class, for example, they said is the best prepared to ever go to college of any class that we've ever graduated at that level in Kentucky. The number of graduates are increasing. So we are making strides. Our scores are going up. We still lag behind. We haven't reached that plateau yet, but we came from 48th, according to the University of Kentucky study, to 33rd. Now, that doesn't seem like a whole lot, but in only 20 years, that's a pretty impressive number. And the fact is that neither the General Assembly nor the business community in Kentucky lived up to its promises that were made in 1990, because we promised to fully fund education. And the predecessors to your business interest, or maybe some of you all, promised to do your part. Here are the facts. The facts are we didn't live up to our commitment to education from the perspective of the General Assembly because we had other compelling and competing needs. And unfortunately, we don't have an economy and a tax structure that allows us to grow as rapidly as we should have, even though we increased the sales tax and made some adjustments to the deductibility for the federal income tax to Kentucky's taxes in 1990. We still didn't spread the base out enough to where it would actually grow with a services-oriented type economy. The business community pays less now than they did in 1990 to the general fund. So I think there's enough blame to go around. But, you know, Daddy always told me, Mr. President, every time you point a finger, there's 3 pointing back at you. I think it's time to move beyond that. What we need to do, and we can't do it without you. We cannot do it without the business community support in this state. We need to really sit down and take a close, realistic view of where Kentucky is and where Kentucky's going. We can sit here and talk about buckets that leak and who didn't fill them up and who did all day long, but that's not going to accomplish anything. The one thing that will make a difference in our state is if we make a long-term commitment to public education, particularly at the kindergarten and preschool levels. If you talk to 10 educators across America about how do we improve education in America, they'll give you 11 different answers because one of them won't agree with itself. But if you talk about what's the one thing that we know will work, well, we know that reducing classroom size works. We know that funneling those dollars into early developmental and educational programs work. And that's what we ought to do. That ought to be our goal. We ought to sit down here and say, we want to build a Kentucky where the taxes are fair and everybody pays their fair share and nobody complains. We ought to build a Kentucky that we have the ability to grow and fund our government and fund its services. We ought to build a Kentucky where we're proud to say we invest our money in our future and in our children. And that's our challenge. But we can't do it as long as we keep pointing the fingers about who got us here or who didn't get us here. You know, I'm going to start telling the truth. I'm going to start taking my share of the blame because I was there and probably should bear part of the burden. But I think it's also welfare that everybody else does too, because we can't get past this conversation and get it to the point that it needs to be unless we do that. So that's kind of where I am, Bill.
Senator?
What's the question again? Just a general comment to start things off. Well, I'm glad to be back by popular demand, and I'm glad you're here, Mr. Speaker, by default. Just a little joke, kind of. It is a pleasure to be with you again, and I always enjoy my time with the Chamber. I noticed my good friend, the Speaker, talks about spending money, and in the last several sessions of the General Assembly, we've been having talk about cutting everything. I was noting what David said earlier today concerning education, commitment to education, commitment to the SEEK formula and other things. I will note that there was a reduction in the SEEK formula this time. It was a reduction by the supposed inadvertent miscalculation of the average daily attendance. So the SEEK formula was cut about the same percentage it was necessary to cut everything else across the board if we really did try to balance the budget. The other thing that I would talk about state to you about the presentation this morning, when we talk about the level of general fund expenditures, there was an asterisk there that talked about the amount of ARRA money that was received by the state government. And I will tell you that in a state government that has a total expenditures of $24.7 billion a year in 2010, $886 million of that was with ARRA money or stimulus money. And in 2011, $803 million was in the budget for ARRA stimulus money. So there was a significant amount of expenditures that were made over and above the amount of tax revenue that we have in the general fund. And we've already had to deal with that issue in this fiscal year because we don't have any ARRA money this year. And that's really what the argument in Frankfurt was over in the last session of the General Assembly and the last regular session of the General Assembly. Were we going to continue to depend upon these non-recurring revenues or structural deficits, and how are we going to make up the difference for that $800 million that we've instructed the governor not to include in ongoing expenditure levels or ongoing expenditures and programs? And that's a severe problem that we have. We could talk about the situation as far as Medicaid, and I'm very concerned about Medicaid and the implementation schedule that we have, and whether we'll actually save any money for the budget with managed care. I would be satisfied if we were able to maintain the level of expenditures that we have in Medicaid. We told the House and the governor that he wasn't able to save $140 million in 2012, the fiscal year that started July 1, because he would not be able to implement the Medicaid program by July 1. And sure enough, they have contracts signed, but what's going to happen on October 1? How many of those people are going to have provider networks out there? There's a $200 differentiation between the level of expenditures for children under 1 year of age in that program. And are the hospitals going to sign up? Are the providers going to sign up? There are a lot of unanswered questions out there, but the one thing that is a constant is the big issue that we face in the Commonwealth of Kentucky is not what we can spend, but what we can afford. And we can't afford things unless we grow our economy. We can't afford things unless we create more jobs. We cannot afford things that all of us would like to do unless we change our tax structure, which the Speaker alluded to, and which we change other public policies, which 95% of the people in this room here would agree have to be changed for us to compete with other states, because if you don't have well-paying jobs and create your ability to compete with other states like Tennessee and Texas and Florida and other states of the South, and that was our competition for several years. But now the political climate is changing to the north, which I affectionately used to refer to as the Rust Belt. And all the legislatures in those areas are changing to more pro-business composition, and the governors in all those states are changing to more pro-business competition. And we're going to be in competition with governors that are smart, that are forward-thinking, that know that they have to create jobs to provide these basic services. Mitch Daniels comes to mind. He's going to leave any sort of negotiation on top with most other governors. And now you have a new governor of Ohio and the other governors up north that are going to make basic changes. And the changes that we have to make in Kentucky to our tax code simply must be predicated on this premise, that Kentucky must be the best place in the United States of America to create and retain jobs. Because if we don't have a higher percentage of our population employed and don't increase our per capita income, then we can't do all the other good things that we want to do. And saying that business is not paying enough is not a precursor to asking people to locate here. I could give you multiple examples of the differences that we have in this state that make us not a good place to do business as compared to other states. And one of them is a pretty simple example, is the amount of money that we borrowed from the federal government this year, over $800 million from the federal government to pay our unemployment insurance. And Tennessee borrowed about $20-something million and paid their money back. Who's going to pay that $800-something million back? The people that are sitting in this room are going to pay it back, or folks that want to come here. Who's going to pay the unfunded liability of our pension fund? The people in this room are going to pay that if they stay in Kentucky. Who's going to pay for the structural deficits? Why is it not enough just to budget from one cycle to the other, but why is it necessary to make the structural across-the-board changes that we need to make so that we can balance our budget and cut our base down next year? That's what John was talking about. When you do these one-time fixes, you get deeper and deeper in the hole all the time, and that's where we are right now. We have at least, in my opinion, a $700 million problem when we come back next year. And when the governor proposed his budget, Mr. Speaker, and sent it over to you guys last year, he had $800 million of money proposed in that budget that did not exist. Over $450 million of that was to bond the scholarship funds that are paid for by the lottery monies. And he was going to use that money to make current expenditures in this biennium that we are right now and bond that $450 million. That's not good public policy. And he was going to use over $400 million of license fees for slot machines that did not exist. And that was 5 years worth of license. Now that's almost $900 million that was going to be expended by the governor's proposal. And wisely, the Speaker of the House and the members of the House A&R Committee discarded that proposed budget and went about to try to create a budget that we could live with. And I won't go into the detail of that. But the bottom line of it is we have a much better budget than the governor proposed, but we have very serious problems. And the most serious problems we have are our unfunded liabilities and these bills that will come due in the absence of this ARRA money. And we can't wait until after the November election to start looking at these sort of things. These discussions need to be had now and in the open. And I appreciate the opportunity to come here and talk about some of these problems.
Mr. Speaker, let's follow up on a couple of those things. First of all, and we'll sort of be all over the map here, but on Medicaid, you have endorsed the plan. You are confident that it is the right path. And Senator Williams seemed to suggest that around October 1, we'll find out how successful it is. Could you offer some thoughts on your confidence?
Well, what we did, Bill, was look at what I call the evidence. And I'm not criticizing anybody who has a different view. I mean, that's what the General Assembly is all about. But the fact of the matter is the evidence that we looked at, the credible evidence that was brought and testified to, showed that other states had gone down this path of managed care, that these types of savings were very easy to, I won't say easy, but were ascertainable in a state like ours, in a situation like ours. And in fact, there was some independent verification of the fact that this could occur. So we felt like that the governor should be given the chance to go ahead and try his plan out. I am confident that it'll work. If you looked at the vendors that were chosen, they're all nationally accepted, and companies, managed care. We all have managed care. I mean, managed care is the way you have to go, right? And the only managed care example that we had in Kentucky with our Medicaid population was, of course, Passport, which was successful, by the way. And even though they may have made some missteps along the way about what they did with some of their money, if you look at the overall package, I think everybody agrees Passport was a good deal. It was a capitated rate. It saved the state money. The vendors that I've talked with, Mr. President, that are under the Passport system liked it, because even though they may not have gotten the same fee or even a lesser amount, they didn't have to put up with the bureaucracy. And what we discovered as we went through the Medicaid task force, or what I discovered and came to realize last year, was that unfortunately state government cannot retain the level of expertise that it takes to run a very complicated and large-scale endeavor like Medicaid, because as quick as we train somebody in how to do it, the private industry folks scarf them up for double the salary that we can pay them. Medicaid directors, I am told, are the fastest changeover of any government position throughout the states at the executive administrative level. So I think we're on the right course, and there's going to be some people who probably aren't going to like it, some of the providers. You know, when you save that kind of money, it's going to mean that somebody is probably going to cry a little bit. But the fact of the matter is, the program, as it was growing, was not maintainable. It was not being administered properly. And I think Governor Beshear's got us on the right track.
Senator Williams, I think I understood Representative Stumbo to say in his opening remarks that the business community, corporate Kentucky, is not paying their fair share.
I'm not going to switch off of that topic until I respond to what the speaker has to say about that, if you don't mind. The bottom line of it is what the governor said is that we need $168 million taken out of the 2012 budget and move it back to 2011 to pay the bills. And he said he could accomplish some of that by savings, and $140 million would be having to take from the fiscal year that we're in now and move back to the fiscal year we just finished. And one of the reasons is because traditionally at the end of every year they roll over bills at the last few months into the next year, but our match rate was different. Our match rate last year was 80-20. The federal government was going to pay 80-20 under the ARRA, and this year it was going to be 70-30. So he wanted to prepay as many of those things to get a better match rate, and we agreed with that. But we said, Governor, you cannot accomplish the savings in 2012 by trying to implement managed care because you can't get it in place in time, and too much of the year is going to be gone. So we gave him an additional $70 million in the budget that was ultimately passed. And we said, save $70 million if you can, and we'll take a look at it. Well, lo and behold, now the governor says that he has a carryover out of the Medicaid budget of $53 to $54 million. And now that we gave him additional $70. Now you add that $53 million and that $70 million, and that's about the $140 million we told him he couldn't save this year. So either they weren't truthful with the General Assembly last year when they said how much money they needed to balance the Medicaid budget last year, or they're not going to be able to do it this year. We won't know by October 1st how much savings, if any, they're going to be, because October 1st is the date that these three companies and the other 7 regions start providing services, and bills start accruing on that day, and they won't be paid even under prompt pay until after the election is over. And so we won't know till December and February and January and next year. And when we go back there at the budget time next year, we still won't know, Mr. Speaker, whether we're going to save any money. Now, I believe that managed care is the way to go, but I see Auditor Llewellyn here, and I think she properly found in her report on the Kentucky Medicaid system that we did not have the expertise in the cabinet to determine whether we were saving money under the Passport system. How many people do you think they're going to lay off over there in the cabinet now that they're not a fee-for-service organization now? The answer is none. You know, they're going to keep all those employees, and there's going to be about 17 or 18% less paid to providers in this state. And I don't know whether the providers will participate in these plans or not, and it's still out there. If we can save $1.4 billion over the next 3 years, why did the governor wait 3.5 years into his administration to go with managed care when everyone told him that that's where it's going? Why didn't he enter it into a more prudent matter? We're not going to save that much money, and let me submit this to you. We're fixed to enter into the era of Obamacare. Right now, We have 815,000 Kentuckians out of a 4.2 million population on Medicaid. We're probably going to add 400,000 more, and the federal government will not pay for that. They won't pay for all of them. But in addition to that, in 7 of these areas, 7 out of the 8 areas, you've got people that are going to get capitated payments. That means that they get paid so much per month for every person that they have on Medicaid. Now, does it make sense that they're going to have tables at every mall saying, sign up for your Medicaid here? Or when they have somebody come in and they'll send them a letter, is anybody else in your family going to be eligible for Medicaid? They're going to stir the pot. And I tell you that there are going to be a lot more people sign up for Medicaid under this managed care capitated plan than we have now. And the other thing is, if you're a smart managed care person, you're going to spend more money up front to do an examination of your people to try to take care of chronic care. So we're not going to save any money. Should we go to managed care? Definitely. But when people tell me, where are we going to spend this money we're going to save? We don't have any money. If we save money, we'll be just less deeper in the hole than we are right now. We don't have any money. We're structurally imbalanced. We're in the hole. We don't have ARRA money. And we've got 400,000 more people coming on to Medicaid. Tell me where the money is. And that's the reason in the last session of the General Assembly, we wanted to do across-the-board cuts to prepare for this, to get our base budget down, so when we come back up there next January, we'd have a lower base to budget upon. And not use this shadow money again. And that's the difference between the governor's approach and the approach that I propose. I think that the only way we can catch up is change our economy and grow jobs. We cannot continue to do these mirrors and images there to act like we're okay. We're not okay. The Medicaid situation is not okay. And this management system is yet to be proven out there. And they sign these 3-year contracts. You think these companies are going to participate for 3 years if they can't make any money? One of the companies right now has bid the under 1-year-old at $200 less a month. Now, they say they're going to assign these populations a third between these 3 companies. Why, as governor, would you assign a third of your under 1-year-old population to a company that's going to charge the state $200 a month more? And why, if you were a provider, would you want to sign up with a managed care company to be in their system if they were getting $200 less a month than the other company? Are they going to reimburse you more? I don't think so. So these are problems that we're going to have to go through, but I wouldn't be spending that money that they claim they're going to save at this juncture.
Mr. Speaker, response?
Well, it's not unusual. Jimmy Lee, who probably knows as much or more about the Medicaid budget than anybody in the General Assembly, will tell you that it's not unusual for us to be faced with these type of problems. When Governor Fletcher left, I believe there was about a $400 million shortfall in the Medicaid budget. So a lot of it is done with the way they pay the bills, with some accounting type measures. It's not really a structural imbalance like you and I would think of one. It's just the way that they do business. And there's probably a better way to do business. I mean, managed care is a better way to do business. You know exactly what you're going to be paid up front. Is it a perfect system? Probably not. There's probably going to be some issues, Mr. President, that the General Assembly will have to look at. But with the passport example, you know, passport, one of the issues that the auditor questioned, and rightfully so, was whether passport had the right to distribute monies that it had effectually made. It had made about $23 million, I believe, Ms. Critt, and there was no provision in their, I looked at their contract, there's no provision in the passport contract that said they couldn't distribute those monies back to the core providers and the people that were the nucleus of their system. But there was no provision that said they could either, and the reason was nobody ever thought passport could make any money. I mean, people, I was there when we started down that road, and I remember everybody saying, well, it's just a grand experiment, it'll never work. Well, it did work. And managed care is working, and we're all experiencing in our private sector experience with our insurance. So, I mean, we're started down this correct road. Now, what the Senate had proposed was to an across-the-board cut. Well, that sounds pretty good. Let's say, you know, if I ask everybody in this room, do you believe that state government across the board can get cut a 0.5% or 1/4% or 1/8%, everybody probably hold up their hands and say, yeah, but let me tell you what that does in real dollars to a district like mine. I live in eastern Kentucky. It would have cost my school district, Louis, right at $400,000, that 0.5% cut. Our position was, why would we want to do that if we don't have to? Why not give the governor the opportunity to enact these cuts? All the information, all the evidence pointed to the fact that it was ascertainable, that it could be done. The independent study that was done verified that he could do it, and his history showed through his management of state government over the previous 3 years indicated that everything looked like what he said he could accomplish. So was I willing to gamble with $400,000 out of my school district's money that's already strapped for funds? No. There was no reason for us to do that, and we were joined by the Republicans in the House and the Democrats in the Senate to agree with that. So I think we're on the right road. It's good that we've had these discussions. It's probably good, Mr. President, I don't know about you, but I've learned more about Medicaid in the last probably 18 months than I did in the previous 18 years in state government. It's not my field of expertise, and I was lucky to have Benny Bailey as my state senator, who has a Ph.D. in health provider services. So I listened to Senator Bailey to a large extent. But as we evolve our knowledge, we'll be better able to participate in the type of decisions that are going to be critical to manage this growing problem, because it's not going to go away, and it's only going to get larger and larger and larger. It's going to be a challenge for every state in the nation, including ours. So I think we're on the right path, and I think that the developments that we've seen in these past 18 months are going to prove to be positive.
Yeah, our proposal would have held harmless elementary and secondary schools if the funding changes came. What I hate to see is a clawback after education budgets are made of SEEK funding, and that where a school district cannot depend on what we say and the money is not there. So we had a provision to do that. The bottom line of what I'm saying is that we were downgraded in the Moody's report because of gimmicks that have been used to appear that progress is being made on our budget situation. Restructuring of debt, which means you're not paying your bonds, you're not paying the interest on the bonds, you're issuing more bonds and paying the interest and putting it off, kicking the can down the road. That's there. This laying off of employees and furloughs does not help you next year. It gets one-time money this year. It's not cutting the base expenditure. And it's punishing state employees when there should be larger changes from the top down and not individually for state employees. All this one-time money that you have exacerbates your problem, continues spending levels at an unsustainable level, and creates a serious problem when we come back next year, strangely enough,